Canada does not have enough oncologists to meet the full needs of cancer patients. A new medical report is highlighting the need for more oncologists across the country. The gap is fueled in part by our aging population. Around 30 medical oncologists and 30 radiation oncologists graduate every year from Canadian training programs. It's a number that a group of cancer researchers says just isn't enough to meet the needs of patients with cancer. So joining us to look at what needs to be done is Dr. Keith Stewart. He's the director at the Princess Margaret Cancer Centre. Good morning. Thanks for coming in.
Good morning. Thanks for having me.
Listen, you say there are two main reasons that we have this gap, where we don't have enough oncologists. What are they?
Well, there's a confluence thing. So it's, first of all, in general, people are living longer and aging better. So that's issue number one. Cancer is a disease of aging. So we have more patients diagnosed with cancer. The second, I guess, good news is people, once they have a cancer diagnosis, are living much longer than they used to. And the third thing is the treatments they receive are more complex, so they require more medical intervention. So those three things together mean we have an increased burden of responsibility to look after those patients.
What does this look like on the front lines? How does this shortage affect patients right now?
Well, if there's not enough oncologists, there's not enough space, beds in the hospital, chairs for chemotherapy, it means that the wait times to see a doctor, an oncologist, get longer. That's not a good thing in cancer. Generally speaking, we need to see patients quite quickly before the disease progresses. And you've seen that across the board. Surgical wait times, times from referral to the oncologist can see the patient have all been extended. In fact, in British Columbia, just recently, they began to send patients for radiation into the United States to try and alleviate the wait times.
What are the oncology specialists that our system is in need of most right now? Where are you seeing the biggest gaps?
Well, it's really across the board. We need more medical oncologists, radiation oncologists, and we need more supportive care. But as you live longer, of course, the anxiety and burden of living with a cancer diagnosis is greater, and we need more palliative care physicians and more supportive care. We also need different types of staff, I think.
Plus, caring for yourself or caring for a loved one as you hit an older age or you're part of that population becomes more difficult as well. You've got seniors caring for seniors in advanced age, and that's not always an easy process.
No, in fact, for that reason, at Princess Margaret, we've recently started a caregiver clinic, which is not only looking after the patient, but if their family is feeling distressed, we actually have a clinic where we can give them some support now.
That's incredible.
Yeah.
Listen, you've emphasized that it's not just about trying to attract more oncologists or more doctors, but also looking to expand or to share some of this burden of care. What does that look like?
Yes, I think we need more oncologists for sure, but we also need more nurses in the field. We need nurse practitioners, physician assistants, and a new breed of doctor, I think, which is a GP oncologist. These are family practice doctors that specialize in looking after cancer patients, symptom management, and then the surveillance. Once you've survived a cancer, which many, many more people are today, thankfully, they need regular follow-up, and there needs to be a schedule of how often to get a mammogram or to get an x-ray or to get blood tests, so they do that.
Answer this for me. There's medical experts such as yourself and researchers who say, okay, here's the problem and we can see what's coming. And you knew exactly what we need, but we have a hard time getting to that. So what needs to be done so that we can get more doctors? Like, is it too much red tape? Is it training? What is it?
I think the entire health system's under a bit of strain because of the aging population. No kidding. You read in the news a lot, and you've probably interviewed people about the shortage of family doctors. So it's not just oncology. I think the system is struggling to keep up with an aging population. Ultimately, it becomes resources required, but of course the government has to balance that across all the other needs, so it's a challenge.
Walk this into the future for me. What does it look like if we don't start to increase the number of people we have giving cancer care in this country? I
think we'll solve it, but ultimately it would mean longer wait times, delayed diagnosis, perhaps more deaths. It is the leading cause of death in cancer today, cancer, unfortunately. I think we'll solve, and I think one of the solutions is to deliver more care at home, to deliver wraparound services with the types of support staff we talked about, particularly if we can deliver care closer to the patient's home. I think that's one of the solutions.
Okay, well, we have a lot of government officials that listen to this program, so Dr. Stewart, here's your chance. If you could say something to them that would fix this problem in the fastest, best way possible, what would that be?
I hate to say it, but more money would probably help.
It's all right if that's what's needed.
But you know, I think a rethinking of how we design and deliver care is probably the most important thing. How do we integrate care from the time of diagnosis, the delivery of care at home, the services that can be delivered in the house that don't require coming into a major cancer centre for specialised care? How much more can we deliver back into the community after the diagnosis? A lot of patients, once they survive, they don't want to leave the cancer centre. It's protective. But we need to educate people and physicians in family practice, for example, to learn how to manage those patients so we can alleviate the stress on the cancer program itself.
Spread out some of that expertise.
Yes, exactly.
So people aren't driving into Toronto. Dr. Stewart, great to have you here this morning. Thanks
Thank you for
coming
having
in.
me.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.